Hi everyone. Our lecture today is called What is Cancer? I chose this topic because I remember how I viewed cancer back as a year 1 student. It was this very scary term for me, and I had the impression that cancer is this rare disease that takes away patient lives. While that's partially true, I learned that a lot more depth is required to evaluate a cancer patient. In this lecture, I plan to give you guys a very brief and superficial look at cancer, but it should help you form a more clear picture of cancer in your head. So what is cancer? Cancer is an uncontrolled multiplication of cells. And it can happen anywhere in the body simply because we have cells everywhere in the body. The cells of the human body multiply all the time through mitosis. This process is very strictly controlled, and if for any reason this control is lost, the cells will start to multiply uncontrollably. These cells can then form a tumor. Tumors can either be benign or malignant. Benign tumors grow slowly and predictably, and they stay localized to where they grow. Malignant tumors, which is what we call cancer, are formed from cells that can rapidly and aggressively spread and cause damage to other parts of the body. This spread is called metastasis, and can happen when these malignant cells spread into surrounding tissue, either through direct contact with the tissue, or when the cells are carried to other parts of the body through blood or through the lymphatic system. How do we diagnose cancer? Since cancer is essentially just the growth of cells, it can very often be asymptomatic. This means that it can grow and spread in silence. There are, however, some symptoms that cancer can cause. These include fatigue, weight loss, fever, and night sweats. We call these non-specific symptoms because they are generally a result of the body trying to fight off the cancer. Another non-specific symptom is lumps. These form when the tumor is large enough to be felt from outside the body. As the cancer grows, patients can start developing symptoms more specific to the type of cancer they have. For example, a cancer in the colon can cause abdominal pain or blood in the stool. A cancer in the esophagus may cause vomiting or difficulty swallowing. And the cancer in the breast would cause a breast lump and also bloody discharge from the nipple. The diagnosis of cancer can only be made by viewing the cancer cells under the microscope. We call this histology. Histology is obtained through getting a biopsy. This involves cutting a piece of tissue from the suspected area of the body and looking at it under the microscope. In some cancers, instead of cutting a piece of tissue out, it's preferred to use a needle to take out some cells from the tissue, as you can see in this diagram. This is called a fine needle aspiration, or FNA for short. One more thing worth mentioning would be tumor markers. These are substances in the blood that are measured to aid the diagnosis of cancer or monitor its progression. An example of that would be the tumor marker CA125. If elevated in the blood, may indicate the presence of ovarian cancer. It is also worth mentioning that tumor markers are not the most reliable when it comes to diagnosis, and in most cases, a biopsy is still very much needed. So, which individuals are at highest risk of developing cancer? The older a person is, the higher the chance of cell damage and mutations. Family history is also a major factor. Genetics play a major role in cancer development. Smoking and alcohol both contribute to cancer through many mechanisms, cell damage being the main factor. Another cause of cell damage is exposure to radiation and certain chemicals. Another one people forget is obesity. Obesity causes significant changes in hormone levels and the control of inflammation in the body, and this predisposes to malignancy. There are a few risk factors that are very specific to some cancers, like HPV infection in cervical cancer and sunlight exposure in skin cancer. Now that we've diagnosed the patient with cancer, what is the next step? It's important to understand that patients with cancer are very different. It's crucial to evaluate the malignancy in order to approach it correctly. We evaluate cancers by staging them. This staging process is based on evaluating variables like the size of the tumor and the extent of its spread around the body. These variables are obtained through physical examination, imaging, and biopsy. This helps predict the behavior of the tumor and ultimately the outcome of this cancer. We call this the prognosis. Cancers with a good prognosis can be managed with a relatively high success rate. Treatment options include surgery to either remove all of the tumor or just part of the tumor. Obviously, removing the cancer cells from the body would be a great thing, but when cancers would spread and sometimes even attach to different body organs, surgery becomes a less favorable option. Other treatment options include chemotherapy and radiotherapy. These aim to kill or control the growth of the cancer cells. Usually, a combination of the above treatment options is used for advanced forms of cancer. As healthcare advances, more modes of therapy have shown promising results in cancer treatment. These include immunotherapy, targeted therapy, and hormone therapy. Finally, some malignancies can grow and spread to the point where they are considered terminal illnesses with a very bad prognosis. Palliative care is offered to these patients who have fatal cancers. It aims to improve the quality of life and minimize both physical and mental burden.